Lakeland Currents, your public affairs program for north central Minnesota. Production funding for Lakeland Currents is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org. Closed captioning for Lakeland Currents is sponsored by Nisswa Tax Service, tax preparation for businesses and individuals. Online at nisswatax.com.
Hello, welcome to Lakeland Currents. I'm Carl Sewell. This week we're returning to the issue of housing and homelessness. Since 2014, multiple projects have gotten up and running in the Bemidji area to alleviate the crisis of rising homelessness that was identified at that time. Those include the Park Place Apartments and the Wolfe Center in downtown Bemidji. What effect have these new facilities had? And what continuing needs exist in the region? That's what we're here to discuss. Joining me tonight are two guests, Rick Klun, the Executive Director of the Center City Housing Corporation based in Duluth, and Reed Olson is the Executive Director of the Nameless Coalition for the Homeless in Bemidji and a Beltrami County Commissioner. Thank you both for joining us.
My pleasure to be here.
Great.
Happy to be here.
All right, so to begin, could you each just give me an overview of what your organizations are, what role they play, whatever the public needs to be reminded of about each of your groups? Rick, do you want to start us off?
Sure. Center City Housing is a not-for-profit developer, owner, and operator of housing for people with the greatest needs and the least means. We were invited to Bemidji about 5 years ago to look at the issues of homelessness, and then we were re-invited to do a project here. And we're really glad to be a part of the community, and we operate Park Place Apartments here, which is permanent supportive housing for people who have been homeless and also people who struggle with alcohol dependency.
Okay, and Reed, the Nameless Coalition?
Yeah, and I represent the Nameless Coalition for the Homeless, and we operate the Wolfe Center, which is a 16-bed emergency shelter for people experiencing homelessness, especially people that have ongoing substance use disorder.
Okay, so you're both returning guests to the program. You've both been on here to talk about these issues before, but a lot's happened in the last few years since you were here last time. That's really what I want to focus on tonight as much as possible. There's lots of things to talk about, of course, but since the projects, both the Park Place Apartments downtown and the Wolfe Center downtown, have been in operation for a few years, what effect have they had? What can you report about the successes or continuing challenges and those kinds of things? What kind of update about these projects should the public be aware of?
Well, maybe I can start, Reed.
Sure.
Again, Park Place opened about 2 years ago, and it's 60 units, and I stopped there earlier this afternoon, and as of today, we have 59 of those 60 units filled. We've got people that have been very, very, very successful. They moved in when the building opened, and they still are living there, and they see it as their home. We've also had some people that weren't ready for the apartment setting that have moved on, and they've come in and tried it, and it hasn't been a good match for them.
Okay.
I think that, so we opened our doors in February 2016 and worked kind of a half season, and now have operated 3 full seasons, and this is our fifth season that we're in right now. If you recall, the years leading up to the creation of the Wolfe, there were every winter there would be several deaths, outdoor deaths that were cold weather and usually alcohol related. In the 4.5 seasons that we've been open, there's been one death that I know about that occurred that was a homeless person, a person that didn't have somewhere to stay, where alcohol was involved. I mean, there are other deaths, of course, but we've drastically reduced the amount of avoidable deaths in downtown Bemidji by having our facility.
Right, and that's a core function of what you hope to achieve.
That was our number one mission, was reducing avoidable deaths on Bemidji's coldest nights. You know?
Yeah.
So I've been driving back and forth as we were developing our projects, and without exception, when I began driving from Duluth, I would see a homeless person panhandling or asking for money. It was really nice today to drive into Bemidji and not see that as I entered the town.
Yeah. So when in 2014, the City of Bemidji commissioned a study from Center City Housing to assess the needs of the community. And I think a lot of people were really surprised, or at least had their eyes opened by the results of that study. Reed, I think you were on City Council at the time that was done. That study found hundreds of homeless adults in northwestern Minnesota, a very large need in the city of Bemidji itself. Has there been any follow-up to either of your knowledge? Do we know how the problem itself, because that report said at the time that homelessness was a very big and growing issue. Have any of the factors changed in addition to the two projects we're talking about? Is this continuing to be a growing crisis, or is it plateauing? What do we know now that we didn't know in 2014?
I can answer that kind of anecdotally. I mean, I don't think that there's been a real in-depth study like the Center City Housing one to really be able to do apples to apples. But I know that this year, really nobody that we are serving at the Wolfe this year was there 4 years ago. So I think that there's new people that find themselves in a housing crisis. So it may not be the same people. In fact, I know a lot of people that we have served that are now stably housed and working somewhere, or have sought treatment and are in stable housing. But I don't know if the pressures that existed 5 years ago that kind of create homelessness are still there today. And it's hard for me to know if it's growing. I don't think it's abating, but I'm not sure if it's worse now. I think it's maybe the same. I don't know if that's...
So I asked two of my workmates in preparation for coming on tonight, and they said the problem is not going away. Again, if we move 60 single adults in, and we're housing 60 single adults now, and that's made a difference. But the problem is not going away, and what they said to me loud and clear that's changed since 2014 is the greater exposure to chemical dependency in terms of drugs. And they called it an epidemic. They see it as not going away, and it's a big challenge.
I agree with that. And to Rick's point, I'll say that when Park Place opened up, the Wolfe referred, I think, about 36 people over to Park Place. About 24 of them found housing there. And so last year, we would have expected our numbers to really go down because some of our most familiar faces were no longer coming to us. The people that were staying with us night after night after night for a couple of seasons were now housed stably over at Park Place. And we saw our numbers stay pretty much static. We had a very slight increase. I think it was 50 beds, 50 night stays increase from one year to the next. And you would think with losing a large core of our frequent users that our numbers would have gone down, which was our goal. I mean, our goal is to not be needed, But we didn't see that. We saw a slight uptick, and so there are people backfilling the people that were able to move. And chemical dependency and untreated mental illness, I think, are two of the big drivers, aside from other drivers that I think maybe we'll talk about.
Yeah, that's what I want to get into next, because obviously the problem of homelessness isn't in isolation of all of these other social factors that both of you have experience and knowledge of more broadly. So what are, in addition to chemical dependency, which has been an ongoing issue and over the last decade or two, I think we've heard national discussions and local discussions talking about how this is an actual epidemic and an emergency. But there's other issues as well. I mean, for example, the housing market in general in a place like Bemidji plays a role in homelessness itself, doesn't it? So you could each talk about some of these other factors and how they play into the problem of homelessness.
So Bemidji is a college town.
Yeah.
And Bemidji is very proud of their university and rightfully should be. But the student population rents housing that otherwise might be rented to people that were either homeless or very low income and in poverty. We've talked with the Bemidji Housing and Redevelopment Authority, and we get money from them to help people stay in our building. And they have vouchers that they can't use every year, I think about 100 vouchers, In other words, they could give somebody this voucher and they could get housing if housing was available, that people turn back because they can't find housing.
In what role, in the college students, there's obviously an annual turnover of a fresh influx of people looking for rental housing in this community. There must be other factors in addition. Why is that such a particular force on this?
Well, I'm thinking back to my college days, and people didn't want to live in the dorm for their whole college experience. They wanted to live in a community, in a house with a bunch of their friends. And those college students have parents that'll sign a lease for them and guarantee that the rent is going to be paid and the damage deposits are going to be covered. And so landlords see that as very favorable, rather than renting to somebody perhaps that doesn't have a great housing history and maybe doesn't have the greatest rent history, and they fill up quick.
Yeah.
And when we have such a tight rental market, I think the last numbers that I heard, and I don't imagine they've changed a whole lot, is that we have about a 1% vacancy rate. So at any given time, 1% of the rental units in Bemidji are available. And so as a landlord, you can be very choosy as to who you're renting to because you know that you're going to rent. And so if you have someone like Rick said that has maybe a criminal record or a poor credit or a bad rental history, or even as simple as having several children, a landlord may pass you over and wait for what they perceive to be a more sure renter. There are programs that exist for landlords that rent to people that might be deemed high risk, that is kind of a security, it's kind of a state-ran insurance almost, that if you do have damage or if the people do walk out, there is a fund that can pay you back, but it's not utilized, it's not very well known that it exists.
And it's very much in the pilot stages, is my understanding.
Yes.
I've repeated down in St. Paul, this is a great program, let's bring it to scale.
Yeah.
And so let's not only look at one population, but let's look at other populations, whether it's families or whether it's people with chemical dependency issues or corrections or whatever. And we're just not there yet. Yep. That being said, I guess I'd be remiss if we didn't say how strong the services are and the funds are in the state of Minnesota for housing for homeless people. I happen to live in Wisconsin, and I work in Minnesota, and it's the services and the funds are night and day difference. So very, very supportive here in the state of Minnesota.
And I have tenants. We have guests that stay at the Wolfe. That we a few winters ago we changed I think about 18 months ago we changed our mission statement to better reflect who it is that we're serving and what it is that we're doing, because we find more and more that we're also taking in people who, for a variety of reasons, lost their housing and don't have anywhere immediately where they can go. So there's a gentleman that I met just last week. I saw him again this morning. He's employed. He lost his housing. He's staying with us until he can figure something out. Last year we had someone that stayed with us for a big chunk of the winter, and every morning he got up and went to work, and then he came back in the evening and was saving up money so that he could get another apartment, saving up his deposit and first and last month's rent. We're getting people that are waiting to go into treatment and have nowhere to stay before treatment opens up. And so we're becoming kind of a gap housing place as well, where people have somewhere where they want to go, but in the short term they need somewhere to stay. And they're not necessarily suffering from substance use disorder. Some people just find themselves outdoors, they don't have a support network to help them out, and so they end up with us for a brief period of time.
Yeah, and this gets to, I'd like to get a little more detail on the different role that each of these two facilities plays in the community. So you're telling me the Wolfe Center downtown, I know it's an overnight shelter, and it's for emergency sort of crisis, overnight life-saving.
Right, it's pretty bare bones. We have 16 beds, and we have showers and laundry services. Yeah. So people can come in, take a shower, have their clothes cleaned. We usually have we have clothes that if people need new clothes, they can pick out new clothes. And so on that continuum of care, or that housing continuum, we're the very first stop. When you find yourself outdoors and you have no resources, you're not going to run over to Park Place at 2 in the morning and start filling out paperwork.
Yeah.
You know, so you come over to us, and we're going to make sure that you're going to survive tonight. You know, that's our primary concern. We're not going to solve any of the other problems. We're going to make sure that you're safe and warm tonight. And then if you need referrals to other services, we can help you find those other services. And so I think what happens is people that are in more long-term homelessness will stay with us for a period of time and then try and get in over at Park Place and then take advantage of the many more services that are available there.
Can you talk about some of those services and what role Park plays?
I sure can.
Falls in the continuum?
So again, we consider our building permanent supportive housing. So as long as the tenant or resident lives in our building and play by a few simple rules, like get along with your neighbor, if you are able to pay some of your rent, you're expected to pay the rent, and those kinds of things, people can stay there as long as they want to. It's their home, and people call it their home. Services include, we've got front desk 24/7. So if there are some people that shouldn't be in the building coming to visit, then we don't let those folks into the building. And we have some of that. Anybody that visits, any of our visitors in the building has to produce an ID, and we make a copy of it, and we keep it on record. We've got nursing service, and this is the 4th building we've done of this sort. The nursing funds for the first building were the hardest to get, and at this point in time I would not do a building without a nurse. People that are homeless have many undiagnosed health issues, and many times they're afraid to go to see a doctor. We have caseworkers. If a person needs to go to the doctor, we'll go with them to help them get through the anxieties of going into a doctor where they're unsure of what's going to happen to themselves. We've got a food service program 24/7 for part of the building. And not only do we serve 3 squares a day, but if you're out and you miss a meal, we've got snacks at the front desk. Snacks include, sandwiches or maybe some leftovers from the night before, bags of chips, cookies, and those kinds of things. And we staff the building again 24/7. It's common sense stuff, but it works. And people, once they feel comfortable with the staff, utilize the staff. And it can be anything, again, from helping make appointments to playing chess with them at night when they're lonely and they can't fall asleep.
And you said that you have 60 beds there, and they're almost all full, or they are all full at this point?
They're virtually full. We have 59 of the 60 full today.
Is it all individual units? Do you have families there?
We do not. It's all single adults, and I'm really glad you asked that question, Carl, because one of the things we haven't touched on today is family homelessness in Bemidji and Beltrami County.
Yeah, I believe the 2014 assessment said that in the Bemidji School District alone, I think the number I remember was 230 some homeless students within the district,
yes,
which is kind of a shocking number.
Yes, it is.
So could you talk about a little family
probably
homelessness?
underreported. I think, and that's, we both of our facilities are focused on single adults, and that's I think the real kind of the unseen and unmet needs are for families. We have the Village of Hope, which is a wonderful, wonderful place, but I believe they have
that's located.
It's just off of downtown.
Oh, okay.
And that has, are there 35 beds total? But it's broken up into family dwellings, And I know that I think they have around 200 or so people on the waiting list. So they're serving about a quarter of the people, or an eighth of the people that would like to be there. We also have a lot of people that double up in apartments and in houses. So that's one of the reasons why some of the numbers are probably underreported, because people don't want to report that there's 8 people living in a 2-bedroom apartment, because they don't want to get in trouble with social services, child protection, or something
or
like
their
that.
Landlord,
or their landlord, or just the stigma about being in hard times. But
and also another reason why it might be underreported, and I'm not sure about this, but if you're looking at one snapshot when the surveys and interviews were done at that one time, that might capture the whatever the number is, the 200 some at that moment who were experiencing that crisis. But Were those results including people who, let's say, over the course of a year? Because these are cyclical and sometimes periodic things. You might find temporary housing somewhere and then not get captured in that number. Whereas
really depends
if you look over
on-
the course of a year, you might find that it's double that or triple that.
Yeah, it really depends on who's doing the study at what
Right.
time of the year. There's what's called the point and count time that the Wilder Foundation does every couple of years, and they do it in the middle of January. And there are people that are homeless all summer long that in the middle of January they found temporary housing, or they're not going to report that they're living out
Yep.
under a bridge someplace
That's
in a tent.
frustration for me is having, they call it the pit count, the point in time count, that it happens in January. Because sometimes we see our numbers on a really cold, if there's a real cold snap, some of the people that we serve, one of the reasons that they're homeless is because they've burned every bridge with all their family. They've lost their support system. But when it gets to 20, 30 below, their family will say, okay, you can come in. I don't want you outside when it's this cold. So sometimes we'll see a small dip in our numbers during a cold snap. Now last year, the cold snap lasted almost a whole winter, so we saw our numbers really go up. But usually those first snaps, when it's below zero, we'll see a small dip. So when you do a point in time count in January, when people are the hardest to find and their family are the most understanding and allowing them in, it's really hard for us to get an accurate count in our community because people they're not out. I wish we would do it in September or October when you're going to have a better, I think it's going to be a more realistic. Snapshot.
So again, I'm not a resident in Bemidji or Beltrami County, so I don't know all the intricacies, but I do know in other parts of the state, the school districts have a homeless counselor. Mm-hmm. Is
And
that
we do.
true?
Yep.
So what do they say about their numbers, Reed, if you know?
That's a great question. The last number that I know was a little bit higher than the one that I believe that you quoted from the Center City study. I think it's gone up a little bit, but I'm not sure. I'm not sure exactly what their role is in the community as far as helping kids get to services. But it is a big issue because children that don't have stable housing are not focusing on their homework. They're not focusing on school. They're focusing on survival. And we know now kind of something that people are paying more attention to, that the state's paying more attention to, is ACE scores amongst children, and ACE stands for Adverse Childhood Experiences. And unstable housing, unstable access to food are two big ones. Incarcerated parent is another one. And so we have a lot of kids in our school district that have a lot of issues. A lot of it is underpinned by lack of stable housing.
So one of the numbers that I've heard is that any time a child experiences one episode of homelessness, they lose up to a half a year of school that they have to catch up because it's that dramatic. If they're living in a car or if they're living on somebody's couch and they don't know where they're getting their food from or if they're safe or not,
Mm-hmm. Yeah.
It plays havoc on them, and it's understandable.
So what do you think needs to be done to further address these issues? I think, as we've talked about, some very good, very successful programs have gotten underway in the last few years. What further, not just in Bemidji, but statewide, region-wide, what needs to be done now to help these kids, for example, that aren't finding stable housing in our community and in lots of communities around the state?
I'm going to talk about one subset, if I can, of those kids, and that's kids whose moms are pregnant or have just had a baby and they're opioid dependent or drug dependent. My understanding is that baby, the government, the county government, is required to take that child out of the home. So we've got moms that aren't able to keep their babies because they're drug dependent, and in many cases they're not able to live with their older children. I believe there's a very, very strong need, and there are programs for those moms in terms of services, but I believe there's a need for housing for those families so the moms and the babies and the kids can stay together while the mom's trying to recover.
There is a program that the county and Sanford Health are doing right now called First Steps to Healthy Families, and that targets that demographic specifically. And we just had an update at the county on that, and one of the biggest hindrances to success in that program is finding stable housing. You know, they really see that is the number one thing that is keeping, well, I don't know if but it's one of the main hurdles that are keeping women from succeeding in that program.
So there is a permanent supportive housing program in Bemidji called Conifer, and some of your listeners are probably familiar with it. They're looking at adding some more housing. They were funded in one of the last governmental funding rounds, and there's a strong likelihood that they will specialize in some of the units in the building to serve the moms that I just talked about. And there's a number of organizations, Sanford in particular, that is willing to and are providing services to those moms, and it would be a perfect match.
Mm-hmm. But generally speaking, I would say that what the community really needs is we need more access to mental health treatment, therapy, more access to treatment for people that are suffering from substance use disorder, and we need more housing, just plain more housing. I'm happy anytime, if it's a $500,000 home that's being built, people are going to move up, and it's going to free up, units at the bottom. We need more housing at all income levels. We need workforce housing, supportive housing, and upper income housing in our community.
Okay, and as we're wrapping up our conversation a little bit today, what's the next steps? What's the future? What's the status of each of your organizations right now? Looking in the near term down the road, both Center City Housing, I know you have projects all over the state. What's coming down the road for you guys?
Well, I guess I'd start by saying if the community of Bemidji, Beltrami County, and the local tribes asked for our help, we'd love to build another building here. We don't want to step on other people's toes, so we probably wouldn't build family housing here because Headwaters and Village of Hope are serving those folks. But if somebody was looking for us to build chemical dependency housing or mental health housing, we would gladly look at doing that. In terms of what we're doing elsewhere, we're finishing up a 50-building unit right now in Duluth that's going to house folks with mental health issues. And we learned on Friday that we've got over 3 of our buildings, we got $500,000 worth of grant money last Friday for 1 year, or almost $1 million for 2 years. Friday was a very good day.
And where did that grant come from?
Came from the Department of Human Services in the state of Minnesota, and it's called HSAMI. HSAMI is the acronym, and it's Housing Supports for Adults with Mental Illness. So we're doing that. We're in the process right now of building a building in Inver Grove Heights that we broke ground for a couple months ago, and that'll be 40 family units, permanent supportive housing for families that were experiencing homelessness. And we're looking at 2 other mental health buildings, one in Duluth that we'll know about the funding within the next couple of weeks, and another building in Rochester for the same group of folks, people with chronic mental health issues. So our as we call it, our pipeline is full, but we're really committed to solving community needs where we're invited. We're not carpetbaggers. We don't go in and try to push our way in. We were invited into Bemidji, and it's been just a great match.
Okay, and Reed, what about the Nameless Coalition?
We are looking at ways that we can expand our services, trying to increase the amount of beds that we can have. And we are also looking at what we can do in the future about having day services, having a drop-in center to kind of take some pressure off of the library. So kind of smaller steps, but things that'll make a big impact in the lives of the people that we serve.
All right, well, thank you both for joining us and giving us this update on this very important issue in our community. Thanks for being here tonight.
Thank you very much.
Yep, it's a pleasure being here, Carl.
And thank you at home for joining us tonight on Lakeland Currents.